as they're stretching their hand, you realize that you predict another pattern of injury if that happens. And in this, as that is happening, as this person is stretching, that means this hand here will the one that will touch the ground first. And what will happen? You expect injuries at the wrist, deformity at the wrist, injury most commonly known as a silver fox deformity. So and then again, the impact or the force will be transmitted up here. So as that is happening, and at the radius and ulnar, then we can have a fracture at that point. Okay. Again, we can also have a dislocation or even a fracture at the elbow. But again, from there, still, if it misses there, this force as it's being transmitted. Then, if it don't happen there, then we can have a. Hello and welcome to EMS-AFRICA. My name is Patrick Toya, and in our today's discussion, I'll be taking you through on vertical falls. And our discussion will be on which are some of the predictable injuries that you should suspect when you are responding to such a call. And before I start, our focus will be on when you're responding, how will you predict the injuries when the patient is an adult versus a child patient? And before we start, I want us to go through which are some of the factors that you want to consider, especially when you receive this call as you're responding. Which are some of the questions that you bring in your mind, so that once you arrive at the scene, then it will inform which areas to focus on that will tell you much about the injuries. And number one factor that you want to consider is the distance of the fall. We normally say when the distance is 3 times the height of the patient, then suspect significant injuries. And apart from that, we normally say another factor that you want to consider is the body position of the patient on the impact. How did this patient land? When the patient landed with the head first, of course, you are highly concerned than when the patient landed with maybe the legs first. That's one of the things that you want to ask yourself, the position on how they land when they were hitting the ground. Another factor that you want to consider is the surface in which they landed on. If the harder the surface, the significant the injuries. And maybe another fourth point that I can add is the age of the patient is a factor. As an adult or a child, it will determine the pattern of injuries sustained for this patient. And in that, I want us to look at what are some of the involved forces in a fall that you should that brings about these injuries. One is the deceleration force, and the second one is the compression force. Remember, as this person is falling, if they, for example, they're going to land their legs first, at the point of impact, then we expect the head also to move, and that we expect deceleration to the head, and also the organs will also decelerate at the point of impact. And when it comes to the compression force, you realize that, for example, if this person is trying to stretch their hand as they're trying to break that fall, then you expect the compression force, and this how the injuries to the wrist, the shoulder, elbow will be sustained. Again, if they're going to land with their head first, you realize that the compression force, as it is pushing, you realize that much will come here, and you expect injuries to the spine because of the compression force. As you can see, that you realize how that is happening. So those two forces mostly are involved. And I want us to see which are the injuries that you should suspect when you have this call, and the information that you have, this is an adult patient. So in adults, one of the things that you should note is when they're falling, when the height is more than 15 feet, or we normally say around 5 to 6 meters, about 5 meters, then most of the time, on how they're going to land is most of the time they land with their foot first. So when this happens at the point of landing, and then you realize that the first impact will be there, and then this will be transmitted above this patient, and you expect injuries above this patient. And let's focus on which are some of the injuries that you should suspect, or which are some of the areas that you need to focus on as you are doing your assessment on. The first thing, once they land, of course, the first thing that we expect is injuries at the arm. That's one area that you cannot afford to miss to assess. Expect injuries there. And of course, this bilaterally assess both legs at that point. And then apart from that, remember we said that this will happen at the point of impact, and the force will be transmitted because of the compression force that we talked about. And when that happens, then we'll have a situation where now this force has been transmitted to the tibia, then we can expect fractures there. As you can see, these two bones having fractures. And apart from that, again, at the knees, then we can also have a dislocation, also a fracture can happen. But again, it will not end here. This force, again, will be transmitted. And remember, the femur is one of the longest bone, and most of the time you say the longest bone, they don't sustain much impact, then it becomes vulnerable. Then you expect to have a fracture to that femur at that point. And again, if that will not happen as that force is being transmitted, where will it reach? At the pelvic area. So at the pelvic, also a fracture can happen at that point. That's another area that you cannot afford to miss. Okay, apart from the pelvic, you realize that this, again, it will go back. Much of the impact, the end of the impact will be transmitted to the L spine or the lumbar spine, and that's where also expect injuries at this point. So as you're assessing, you need to focus on those areas, especially when they land on the feet first. That's a very key point that you need to note. Another thing is, as this person, as I said, they land with their feet first, but sometimes in the process of defending themselves, most people normally tend to break the fall. And how do they do that? They normally stretch their hand. So as they're stretching their hand, you realize that you predict another pattern of injury if that happens. And in this, as that is happening, as this person is stretching, that means this hand here will the one that will touch the ground first. And what will happen? You expect injuries at the wrist, deformity at the wrist, injury most commonly known as a silver for deformity. So that, and then again, the impact or the force will be transmitted out here. So as that is happening, and at the radius and ulnar, then we can have a fracture at that point. Okay? Again, we can also have a dislocation or even a fracture at the elbow. But again, from there, still, if it misses there, this force as it's being transmitted, then if it don't happen there, then we can have a situation where at the humerus, we have a fracture at the humerus. And the end will be, all this impact will come at the shoulder here. So if we miss injuries there, then this is another area that you cannot afford to miss in your assessment, because that's another area that you predict to have injuries. Okay, so one thing that we said, that if they fall 15 feet, what happens if it is less than that? Most of the time when that happens, you realize that most of the time these patients, they land in the position in which they fall. So if they come up head first, mostly that's how they land on. And predictable injury in this, you realize that you'll assess based on the impact that they fall in. Okay, so that was an adult, and I want us to see now which are some of the predictable injuries when we are having child or pediatric, because the pattern will be different. So without wasting much time, let's get in. Let's look at children. So for children, most of the time, regardless of the height and the size of the child, most of the time they land with their head first. And this is so because most of the children the pediatric, they have, their head is proportionally large than the rest of their body. That's why most of the time they land with their head first. So in such a situation that you're responding to such a call, and this is a pediatric, then one of the things, some of the areas that you need to do your focus assessment is, of course, at the point of impact, you expect to have injury to the head or the skull. Of course, be concerned about any skull fractures, and apart from the skull fracture, assess for any neurological injury or traumatic brain injury. That should be your impact. And whenever we have any injury to the head, or as you all know, also the spine is not safe. As they are landing that way, then this will be this force compress up, and you expect injuries at the C spine as the deflection and all that. So expect spine injury. Okay, thank you very much, and that's what we have for today's discussion. And if you really enjoyed this video, don't fail to subscribe in the below, and don't also miss to hit the notification button. And kindly, let's meet you in the next video. Thank you very much.